want to thank my Dr. Michael for...
You've never had chiropractic care?
No, I haven't.
Severe crush injuries.
Yes.
And what that's done is it's put a lot of torque and twisting through the kinetic chain of events on your spine, basically. So that's where we're starting.
Spine, but I do feel like my sacrum is off. I'm actually feeling the effects. Like I can actually feel my rib cage feels a little bit torqued to one side, you know, and it's just affecting the whole chain like you were talking about. I mean, honestly, I can actually feel it up to, you know, like even clavicle. Like there's like, you know, anterior and posterior. So I can feel quite the effect, and it's just been like a year and a half of just surgery, like hopping on one foot, like crutches, cane, weight bearing, not weight bearing.
So much compensation on so many levels. The muscles are just compensating and pulling every which way. So it sounds like, I mean, from what you're saying, it's some of your spine all the way from the lumbosacral area, the SI joints, all the way up, and even into your neck. Yeah,
I definitely feel that, and it's into the neck, and then even to the eyes. Like that's the last thing that adjusts is your eyes need to be on the horizon, and I even feel that sometimes that I get migraine headaches now because my eyes just get really strained. Yeah, it's just that, you know, the nerve, you know, kind of like that kind of shooting, stabbing behind the eyes that comes and goes too as a result of everything else, and so it's just.
Right. Torque and twisting, and like we said, the muscles are pulling and adapting and compensating in so many ways.
Yeah.
That what it's done, obviously, is pulled your spine into compression.
Yes, I feel like that's really definitely true.
Yeah, because the spine being like an accordion, I mean, it's probably pulled it literally into compression vertically, and then you have some rotational distortions.
Yes, absolutely.
Perhaps lateral flexion distortions as well.
Yeah.
That's basically 6 planes of motion, if you will. And so they're just off. They're just really tight, taut. And what I'm going to do today is just to differentiate. I kind of divide the line into the completely integrated overlap, where what I'm going to do is look for articular fixation in your spine. I'll explain that in a moment, okay, where the vertebrae become pulled by the muscles so tautly that the little joints, the facet joints, the vertebrae literally become stuck together.
Yeah.
What I'm going to do today is I'm going to check your spine for articular fixation, and then also at some point, as soon as you can, get some massage.
Yes.
Okay.
Yeah, absolutely.
You know, I recommend, I refer
absolutely.
every patient for massage. It's the 1-2 combination. Because the work that I'm going to do, it's not going to reach either full correction or it's not going to stabilize without the support of massage care.
Right.
So I just want to be really clear with that. Okay?
Of course, and that's what I love about you.
And I'm going to give you a very distilled version of what I'm going to be doing when I examine you in a moment, okay?
Great.
So here's a classic model, 26 vertebrae of the spine, and here's a model of 2 vertebrae, so we'll take this out. And normal mobility, of course, you lean forward, you can tilt to the sides, you can rotate, what have you. It'll look something like this, okay? The little joints here, okay, where I'm pointing, facet joints, one over here, there's 2 above, so every vertebrae has 4 joints. In reality, these joints are actually encapsulated, okay? They're sealed, there's a articular capsule, there's fluid inside, of course there's cartilaginous implates protecting it, but those are sealed in, okay? So let me show you another model. The little joints here, we put suction cups in. Can you see that okay? Okay, and the suction cups, not too far from metaphorical reality. It's kind of an oxymoron, I guess, but so they should barely be touching like this, okay?
Yeah.
What happens, they kind of spring in and out as you're moving throughout the day.
Right.
A zillion times. But if they get pushed too close together, the suction cup, like adhesiveness, causes them to stick, and then you can't move well and you can't stretch them apart.
Right.
Does that kind of make sense?
That makes sense.
And in fact, a lot of times, you know, we all stretch, we move, we pop a little bit. Those are early onset mild fixations that we're releasing. But once they get really compressed, more severely and chronically, you can't just stretch it loose, and that's what we're doing with the proper force adjustment. Imagine the 2 suction cups that I just showed you, the ones in the little joint here. I'll hold this now.
Sure.
But we're going to blow them up, make them backwards slice. Imagine these are the 2 suction cups. So normally, you know, you're kind of moving in and out a little bit as the articulations are pumping in and out. But if they get too compressed for too long by muscle tension, sudden impact, gravity, what have you, go ahead and hold this. Try to pull it apart. And that represents they're really stuck together.
Yeah.
It's like two big bathroom plungers. It's not happening. Yeah, you have to really pull them apart. That's what I'm going to do with your spine, assuming that we find areas that are stuck.
Okay,
that's what's going on. The fixation is similar to that. Okay.
Perfect.
That's a whole topic in itself. I know people wrangle with that, especially you know how much force is needed to release it. The key thing we talked about the mechanics. What happens with the nervous system? Okay?
Yes.
Two things. The little joints that we talked about. In reality, those are richly embedded with sensory receptors, various kinds of mechanoreceptors, proprioceptors.
Right.
You could go on, Ruffini, Meissner's, Merkel's, nociceptors in the area, what have you. And when the joint gets too compressed, it irritates, or you can say impinges, the little hair-like sensory nerves that are richly embedded in the articular capsule, more so around the periphery to be technical. On more severe cases, which is probably not going on with you because you don't have the symptomatology supporting it, but in more severe cases, aside from just the joint fixation causing nerve irritation, and of course this model doesn't show those little nerves here, but the big spinal nerve root coming out, the vertebrae can go slightly out of alignment and they compress it like that. You can see where that impingement happens.
Right.
So it goes from looking like this to just like a quarter of an inch out of alignment to where it would actually impinge the nerve. If it hits the spinal nerve like that, typically people have pain radiating pretty far down.
Yes.
In fact, this side of the model even shows a nasty little bulge, bleb here, hitting the spinal nerve, and that's where people typically have radiculopathy. Okay? So in your case, based on the symptomatology, you probably have mild nerve irritation at the facet level with fixation that you're not able to release on your own. If you're able to release it on your own, you wouldn't be here. Right? You say, oh, I feel fine, it's just a little bit of muscle tightness. But there's like that monkey on your back, you can't quite release.
There's an extra element to it, definitely.
And that's the articular fixation. You feel like no matter how much massage you have, how much stretching you do, you just can't quite resolve something. Right. And that's where the articulation fixation comes in. Yeah, just hold it. Yeah, what this shows, issues in the lumbar, sacroiliac. This is a cool educational device. It shows that you can have pain anywhere coming down the butt, the infamous piriformis, all the way down is fair game. Typically, depending on the severity of nerve compression, will be the distance of radiculopathy. I don't know if you can reach it, but if you go up higher, like can you reach that one? Maybe close. Okay. And this shows in the neck region if there's nerve impingement anywhere is fair game here. That's why people quite often have tenderness, pain, soreness coming out to the shoulders because of nerve irritation happening at the cervical region. And so on and so forth here. Why don't you push a little bit lower, and I'll show the classic rhomboid region. There's going to be a lot of nerve irritation, the costal transverse or the articular facets of the thoracic vertebrae. By the way, if you flip this one down, as long as we're this far into it, this shows where the autonomic nervous system, if it gets irritated, yes, folks, it actually does by spinal issues, despite articles you've read, it can affect different organ systems.
Absolutely.
So, okay, I don't want to get too off in neurology, but that's a little bit of a taste of neurology 101.
Great.
Also, for video's sake, I'm not giving a tutorial on how we do a spinal exam. That's a whole other 10, 20-minute ordeal. I'm just going to take 25 years of experience having worked on a few thousand people and 500,000 adjustments, and within 5 minutes I'm going to find out where, to put it in super simple terms, your vertebrae, which ones are stuck, that aren't moving freely and are irritating the nerves and causing some muscle spasm. And what I'm looking for primarily is joint fixation. As a side note, I'm also looking for focal microedema, nerve irritation, and focal muscle spasm. If anything I do hurts, let me know. You're stuck right here.
Yes, I know.
Feel that? Your right SI joint is locked. It's not moving the way it should be. To be definitive, but your ilium has gone down, so the posterior inferior on the right side. Yeah. Okay. And I'm going to differentiate now L5 from sacrum. Here's L5. Is that tender when I push you right there?
Totally.
Okay, what I'm going to do is tilt you to the sides, and I'm just measuring lateral flexion, which isn't that much in the lumbar spine anyway. It's not famous for lateral flexion, but you're just locked here. It's a combination, actually. Might be more information you want to know. It's your L5 and the right SI joint combination are locked. A lot of times people think it has to be either or. In this case, it's both. But I actually have an adjusting move you'll experience in a few moments where I'm going to take out both of those fixations in one move.
Sweet. All of that.
All that's tender. Yeah, because what happens almost always when the vertebrae go out of alignment here, of course the ribs attach on the side, so it pulls those into compression and fixation as well. And oftentimes in the patient, more often than not, you'll feel it over in this area, the costal transverse junction or articulation more so than in the center.
Yes, I actually felt the ribs, and it's been driving me crazy. I've been trying to figure out what to do with that and how to release the ribs, but I don't know.
Yeah, it's like you can't do it on your own. It's just really frustrating.
Yeah.
It's very empathic or humbling profession because I get adjusted periodically, probably at least twice a month, and I can't adjust myself.
No, I'm sure.
So let's do this. Why don't you go ahead and lean back if you would into the chair? You okay with that?
Sure.
It's designed to have you slump back a little bit.
Okay. Yes.
Okay. What this is, I know obviously people watching this can't tell. These are like guitar string, kind of wiry areas of muscle fiber is what they are.
Yes.
Okay, as opposed to the whole muscle being tight or, of course, normal. That is neurologically induced. Whenever you have the wire-like strands that are real taut, is that tender to you?
Totally.
Okay, sorry, I'm gouging away.
It's fine.
That's a sign of nerve irritation, presumably short of infection and tumors and toxins, etc., coming from the spine that's causing the muscles to stay hypertonic in this area. What I'm doing is I'm kind of putting mostly a forward, posterior to anterior glide on the facet joints.
Oh, I just felt on the right side right in there.
Right here.
Yeah,
right and that's locked. She's not moving on that right. Yeah, and that's where it is. It's right here. It's C6 is what it is.
Okay.
Yeah. Plenty of notice before we're adjusting, so you can just relax. And I'm just checking. Right now I'm checking C1, C2 complex. And you're a little stuck right here, right, C2. Might be more information you want to know. I know I'm giving you overload here, but typically when two or more vertebrae are involved in the cervical area, it's the lowest one that's the primary fixation. Okay? So far we have this L5 in your right SI,
right.
T5, 6, 7 area, and then you have C6.
Right.
Let's do this. Let me cross-check on the tape board. In summary, L5 sacral, we need to adjust L5. We'll adjust this area, and then we'll catch your neck. Nitrogen, hydrogen, carbon dioxide that's trapped, and they expand. And that's, so you might hear that popping sound, okay?
So you know.
So what I'm going to do is put a motion in here, just to release this out a little bit, okay? So let's bring you this way. I don't know if you'll be able to see this, that's okay. Then I'm going to contact L5, which is here. You are really flexible, wow. Okay.
Am I?
Yeah, okay.
I would have never guessed.
So go ahead and breathe in, and then breathe out. All the way up. There it is.
Oh, nice. That actually felt really good. Oh my gosh, that feels great. My sacrum feels so much, like it feels like it just dropped out of like that kind of sideways pull. Like this. Oh wow. And then I brought it in slow-mo. Released the fixation and then brought it up and over a little bit on the disc. That's what happened. So let's come back to the chair, if you would. Yeah. That was sweet. Wow, I feel great. I have to tell you, I feel like that split of a second made me feel like $1 billion. It changes your life because those vertebrae they'll stay stuck, forever basically, until you have that proper force adjustment. That feels so good. I just feel like even like blood rushing into the leg. I swear to God, you look different. You're alright. You get a chiropractic poster child. I know. Feels nice and good. Okay. That was wonderful. Thank you. So what I'm going to do now is adjust your C6 vertebrae. Okay. It's got a little bit low on C7. We're going to let me just show you and everyone else what I'm going to do because everyone's so confused about this. I'm going to exaggerate a little bit. Let's say the vertebrae has gone out of alignment like this far, which it hasn't gone that far, everybody. Relax. Okay. And what I'm going to do is contact here, bring the lamina groove right up against here like this. Right. And I'm going to impulse very quickly. So this is going to, the movement I put in is only going to move it maybe 1/4 of an inch. That's it. But it's going to release the fixation and the articulation and bring the vertebrae a little bit forward. And that's going to relieve the pressure of the sensory nerves in the articular capsule and any irritation that might be happening on the larger level. It's going to release it out. Okay? Great. So this is my favorite adjustment. Okay. And I've done a few 100,000. Right. Well, it's true though. That's good. Okay. That's a good track record. Yeah, so here's what we do. I have the contact point here. Okay.
It's the laminal groove, as Eric Dalton likes to refer to it. Let your head drop all. I'm going to give you a 2-3 second notice before I adjust you.
Okay.
It says no surprise. And what I'm doing is I have you laterally tilted. We should usually do this in one motion, but for educational purposes, laterally tilted, rotated into joint play. Okay, this is what I need right here, and I'm going to impulse. So take a breath in for me. Go ahead, breathe in and all the way out. That's it. And here it goes, right here.
Oh, wow.
There it is.
That is crazy.
There it is.
Wow, I feel totally different. Again, that moved so much.
Yeah, it released fully, which is really nice. And immediately
So
that nerve
nice.
irritation is taken away. Now, there's going to be a lag time where the nerve has been irritated for months, if not a couple of years, so to speak.
Right.
Or at least since the foot surgery over a year ago. So the irritation needs to calm down. Okay? In other words, over the next few days, this will keep feeling better and better. Because the nerve, in a sense, was, I'm using the term irritated, it was in a sense bruised.
Wow. And actually now the thoracic feels different too.
Yeah.
And also on the other side of the cervical spine.
Super. Can you handle one more adjustment?
Yeah, I think so.
Okay, because what I'm going to do is come in on the exact same vertebrae but the left side. So there's 2 joints on each side, top, bottom, and I want to make sure I got all 4.
Okay.
So I'm going to release the left side. Here's C6, 7 right here, contact point. And we get up close. And okay. That's it, just relax. And I'll let you know before I adjust. Okay, so we're going to bring the end point, end of joint play right here. Great. And go ahead, breathe in and then breathe out. That's it. Beautiful. And then right here, we'll go ahead and adjust.
Wow.
There it is. Wonderful.
Jeez, that was like crazy. It feels
you're
totally different.
You're like the one-hit wonder. I mean, this feels 90% resolved.
I feel it, yeah. It's like, I don't feel that same tension or tenderness in the upper fibers. And
yeah, it's really beautiful how quite often, like you're experiencing now, it's instantaneous. Releasing that fixation releases the compression and irritation of the nerves, and the nerves respond immediately.
It's different.
Right.
My whole body feels different. Actually, I feel like I'm light and almost like I'm floating or something, and I feel, I don't know, I just feel like kind of like a calm rushing over me. Whereas up until now, really from the point of my injury and the impact, like a year and a half ago, my entire nervous system has been like holding on to tension patterns and all kinds of things, and been putting me through a lot of pain and even dysfunction. And right now I just feel great, like
it just resolved, it just relieved
pain relief, just like nice chemicals going through and reaching where they need to. And
yeah, a lot of endorphins and probably serotonin and who knows, dopamine, whatever is coming through you now, a lot of neurotransmitters.
These muscles is totally different.
Right.
And even into like the rhomboid area, I mean, it just, like you got me below and above, and then everything in the middle just feels even different. I mean, it just, like you got me below and above, and then everything in the middle just feels even different.
Yeah. And that's a concept that I think a lot of times people, a million words doesn't really convey it as the experience.
Right.
That when the articulations of the spine are stuck, you're going to have nerve irritation, you're going to have all kinds of hypertonicity.
Oh my goodness,
And
like,
so
even my rib cage, it doesn't feel as torqued.
Yeah, beautiful.
And that's been bothering me for so long.
All right.
And I've been working the muscles, trying to like figure out how to...
Right.
Wow.
And in this particular case, the muscles were responding again to spinal fixation, causing nerve irritation, and the nerves control the muscles. So the muscles were getting nerve irritation, a signal from the spinal areas of the nerves telling it to contract.
Wow.
And so now all of that's unraveling. And now to help bring the muscles from the PNS aspect, get massage as soon as you can.
Right.
And that'll take care of from that angle coming back up to the spine.
I will. And now that I can drive,